As CEO of the Royal Medicare Local, we're absolutely thrilled to pieces at the prospect of introducing the national digital broadband network to our region. I guess I better start off by giving you a little bit of background information about the region itself. So the Royal Medicare Local region is diverse in nature. We cover 100,000 square kilometres with a population of 106,000 people. Many of the communities within the region have a CIFA index score of 700, which makes them amongst the poorest communities in Australia. We also have one of the largest Aboriginal populations in the state of Victoria, and a growing number of refugees in the Mildura region, which complicates matters even further. The region's population is also characterised by a multicultural community which represents about 47 different cultures and 20 different languages. So put this in the context of health and better health outcomes and communicating with people, it's a challenge to say the least. So what do patients want? I think patients want services to be available locally when we need them and to a high standard, access to highly trained specialists in a timely manner, short waiting lists, cost-effective healthcare, emergency triage when that's indicated, and follow-up care to be provided at the local level. So when we benchmark that with what we've got is that local services are very good, but they often don't meet the needs of individual patients, as local hospitals and other providers are not always funded well enough to warrant the cost of additional services and equipment. Workforce is another issue in that we can not always attract and retain clinical specialists we need to meet patients' demands. Patients have to wait several months, if not years, to see a specialist, and often have to travel between 400 and 700 kilometres interstate at their own expense, often not attending these appointments because they can't afford to do so, and often the journey is very painful as well. The Royal Medicare Local, formerly the Mallee Healthcare Network, has invested heavily in e-health solutions across the region. Solutions such as Argus, which is a secure messaging system. This allows confidential information to be transferred from GPs to allied health professionals to specialists backwards and forwards securely. We've also developed electronic discharge summaries for the local hospital networks, and more recently specialised video consulting services, which Troy will talk to you about shortly. We've installed Argus, the secure messaging system, into every hospital, aged care facility, all the private providers at most pharmacies and community health centres across the region, as it's important that they can communicate. Having done all of that, this however does not solve the problem of cost-effective healthcare, patient triage, or the provision of follow-up care services to specialists that may reside interstate. The video consulting project does, but we really need the NBN to make this service more attractive to GPs and specialists, as when they're making life decisions over a telephone line, they really do need high quality picture clarity. Once up and running with the NBN, this will become a life-saving measure, as patients could be triaged by the specialists, meaning that once in the past patients, or currently patients have to wait 12 months and often longer, and which is often too late in terms of early diagnosis, not to mention the pain and agony of all that time waiting. Specialists could triage the patients over the line and say really, now I can actually see the patient with my own eyes, and I've got the test results and the results of the MRIs and so on. This patient really needs to be seen now. Surgeons and anaesthetists in operating rooms will be able to share the patient's condition with an expert anywhere in the world, in fact, and get instant advice relating what to do next. Patients also wait excessive periods of time to follow-up appointments, and once again have to travel. With clear visual images available as well as test results, specialists will be able to follow up with treatments and progress in the patient's own home if they actually had a technology at home, thus saving the pain and cost of travel again. Only last week we had an Aboriginal patient who had a terminal illness and who was very sick, travelled all the way to Adelaide to see a specialist, The journey was 6 hours in the car with really swollen limbs and lots of pain. We frequently needed to stop to let her out of the car for pain relief and so on. Then she waited a further 4 hours at the hospital in Adelaide, only to be told that the specialist was not available on that day. We then need to do the dreaded journey home. So all of this is simply not acceptable.